our own Dr. George Rust.
This is my whole talk right here, so if anybody needs to go out and check your cell phone or anything like that, that's going to be it. It is 9/11, and in addition to us remembering the 3,000 lives that were lost on that day, I wanted us to spend a little time thinking about and remembering the heroes of that day. There were firemen and paramedics who ran into a smoking, burning, collapsing building to save others because they cared more about saving others than they did about preserving their own lives. And these are heroes in our country. We know something about heroes here at Morehouse School of Medicine. One of my personal heroes, Dr. Satcher, was supposed to give the speech today and asked me to step in at the last minute along with Dr. Montgomery Rice. Thank you so much for giving me this opportunity. I'm honored and a little overwhelmed. So I wore my WWDSD bracelet today. What would Dr. Satcher do? It carries me through these hard times. For the students, here's what you need to know about Dr. Satcher. Now, it was 2 years of working every day with Dr. Satcher before I heard this story. That's how humble this man is. But he was a leader in the student movement as a student at Morehouse College. And he actually did sit-ins with Martin Luther King and with Martin Luther King's brother. He went to jail with Martin Luther King's brother. He went to jail and did a hunger strike with Martin Luther King's brother. And he took his chemistry book with him because he knew he had an exam at the end of the week. And he knew he was going to need that time to study. Now think about if he hadn't taken that chemistry book with him. If he hadn't gone on to get that MD and that PhD from Case Western Reserve University. If he hadn't gone on to lead one of the first national sickle cell centers in the country and help work in creating the King Drew Medical Center and being president of 2 historically black medical schools and being Surgeon General and being CDC director. If he hadn't taken that chemistry book with him. We have all kinds of heroes here at the Morehouse School of Medicine. And Dr. Lewis Sullivan is our founding president. And Dr. Valerie Montgomery Rice is our current president. Y'all can practice the presidential power pose. But the other heroes on this slide are the students. Because these students have chosen to come to Morehouse School of Medicine, preferentially chosen a school that will prepare them to go to the areas where they're needed most, to go into the specialties where they're needed most, and to go to the places where they can make the most difference in the world. Those are Morehouse School of Medicine students. Dr. King said everybody can be great because anybody can serve. Doesn't matter what degree you have or don't have. Joe Newsom was my first boss. He was the maintenance crew janitorial supervisor at a school that I went to, and I got to be his little junior janitor for 6 years. After school and summer times, Joe Newsom taught me how to rotate the mop handle at the end of every stroke to make sure that you got that wax down just right, and how to use a buffing machine without crashing it into the wall to make sure that that floor just shined and you could see your own reflection in it. He taught me about doing excellent work even if nobody was ever going to check up on you, not because the boss man was looking, but because you can choose to be a person of excellence, and you can choose to do excellent work. Joe Newsom taught me about sacrifice, too. He didn't get to graduate from high school. He dropped out so he could help support his family. And he worked at that school for 35 more years before he retired recently. He dropped out of school to help support his mom and his 8 siblings. And he showed me what sacrifice was all about. Y'all have some family here who have sacrificed for you to be here. And they have let you know about some of their sacrifices. And some of their sacrifices I'll bet they'll never tell you. But they want you to succeed, and they want you to make a difference in the world. And they're putting all of themselves behind you so that you can be here today. Those are heroes. the folks that we've graduated who have gone out to those underserved communities are heroes. You know, it takes some courage to just walk in an exam room for the patient you don't know and say, how can I help you today? And you don't know where that's going. I would walk in the room, I'd pull the chart off the door, Luz Maria Mendez. Oh my gosh, not Luz Maria Mendez. Oh my gosh. Her blood sugar was going to be 280 again today. It was 280 last time. We talked about what we could do about it. I never moved the needle on that sugar. But Luz Maria Mendez wanted me to come in the room and hold her hand and tell me her problems. Tell me her troubles. My son's in jail. My husband, he's a good man. He works hard, but he drinks a little. And when he drinks a little, it's hard. And so I would hold her hand, and she would tell me her struggles. Luz Maria Mendez was one of my patients, one of many. The person up in the corner up there, Dr. Otilia Marina had been a personal physician to Cesar Chavez in the farm worker movement. She was the medical director of the Farm Worker Health Association before I came there to be medical director of the Farm Worker Health Association. I think she was a little bit nervous about turning over the keys to me. She sat me down. She said, George, when I go in a room with a patient, I feel like a priestess. They tell me things that they wouldn't tell their mother or their spouse or their kids. And they want me to hold their hand and walk with them on their journey. When I left Groveland, Florida, 2 stoplights, no Dairy Queen, I let folks know that I was leaving. I got a lot of thank yous and that sort of thing. But I got an incredible hug from Luz Maria Mendez, who wanted me to know that I had been there for her and walked with her on that journey and held her hand and listened to her troubles. We are blessed when we're given that opportunity to be that in other people's lives. I first got to grow into my white coat at Cook County Hospital. Now, I put on a starched white coat that was all clean and good looking like you all have when I was at Loyola. And I did my medical school, my internship there. And then I transferred over to Cook County Hospital. In Cook County Hospital, my coat got gritty. It got bloody, and it got tears and spit and sweat. And it got all kind of, well, bodily fluids we won't even talk about today. And I had teachers like Dr. Pat Dowling, currently chair of family medicine at UCLA. But in this picture, he was a third-year resident, on strike with the other residents, demanding things like a blood pressure cuff on every ward and a curtain around every bed for patient dignity. Some of those residents went to jail that day. I don't know if they took their chemistry books. The others snuck up the back stairs to make sure the patients were taken care of. Those were the leaders. And Pat Dowling taught me this quote, "The physician is the natural attorney for the poor." Rudolf Virchow, famous anatomist, apparently invented the lymph node, I'm not sure. Well, when I want to summarize things in simple terms, I look to Hollywood. So Hollywood gave me the outline for my speech. You is kind, you is smart, you is important. Great actor Viola Davis speaks these words to a small child that she's raising. Just say, turn to the person next to you and say that, would you? You is kind, you is smart, you is important. All right, got that out of the way. You got to get those in the right order. Be kind first, and then be smart. People don't care how much you know until they know how much you care. A woman of grace, one of the South Carolina church shooting victims, Cynthia Hurd, a librarian, it was said that her motto was this: be kinder than necessary. Would that we all would be kinder than necessary. The person who taught me that quote about people not caring how much you know until they know how much you care was Dr. Lonnie Fuller, who recruited me to this institution 24 years ago, chairman of family medicine. And he wrote an article, cared passionately about teaching young health professionals to do excellent medicine, evidence-based medicine, but medicine that never forgot that there was a human being on the other side of the encounter. and that related to people in that way. He talked about creating a renaissance of compassion and caring and humanity. And he talked about it as primary caring. I love that phrase. Mother Teresa put it this way: if you can't do great things, do little things with great love. U.S. Open Week, Arthur Ashe taught us this, that it's not the urge to surpass all others at whatever cost, but the urge to serve others at whatever cost. We have heroes like that all over this campus. People who give themselves to community and get their egos out of the way and don't look for any credit and consciously step back to make sure that community leaders step forward and own the process and own the outcomes. At Morehouse School of Medicine, serving is a team sport. And our first-year students took it on themselves to organize a trip to Haiti, get it paid for, pay for the trip to Haiti, and take a week of their own summer vacation so that they could go to a place where they could see people in need, serve people in need, and learn about the tremendous strength and resiliency of the people of Haiti. You don't have to do this by yourself. We're not training Lone Rangers here. Don't try to do this all by yourself. Frederick Douglass said, "We are one, our cause is one, and we must help each other if we are to succeed." So that means you have to acknowledge your own limitations. You have to acknowledge sometimes your own brokenness and acknowledge others' strengths. But when we do that, when we embrace each other, man, we can fly. So be kind and then be smart. I don't know if y'all ever did this. Did you ever take a test and you got such a good score that when they passed them out around class, you turned it over so that your friends wouldn't see it? You didn't want to embarrass them? Y'all did that, didn't you? Y'all are smart people. You're surrounded by smart people, though, so I guarantee you don't have to turn your paper over here. All right? Let your brain loose. Let your brain freak fly. Just be as smart as you can be, as long as you're doing it with each other and helping each other get through. We are surrounded here by incredibly smart, brilliant people who also happen to be deeply wise and deeply humble. When Gary Gibbons went off to be director of the National Heart, Lung, and Blood Institute after being director of our Cardiovascular Research Institute, I think I shared with folks that his arrogance to intelligence ratio was less than 0.01. I didn't know how to measure it. And I thought, how are we ever going to replace a man like Gary Gibbons? And then Dr. Herman Taylor showed up. Just as smart and 3 times as humble? Oh my gosh. How does he do that? We try to use our smarts for good, though. We try to ask big questions. Our team at the National Center for Primary Care asked this question: for what leading causes of death did the U.S. achieve a successful reduction in mortality over the past 50 years? 50% reduction in mortality. In other words, what were the success stories in America's health, and how can we explain them? And there was an answer. We were able to prove this answer. Was it research? Was it public health? Was it primary care, specialty care? Yes. That's the good news. It's an all of the above answer. 7 of the 9 conditions that we found that improved 50% in mortality of the leading causes of death in America require research and public health and primary care and specialty care all working together. So everybody in this room is necessary to have that success move forward in this country and to move toward that goal of health equity. Think about all the scientists and specialists who are required to move HIV/AIDS, which is a disease just being discovered when I was in training. Yes, I am that old. To move it from being a uniformly fatal disease to being a chronic treatable illness. In the short period of time, in less than 1 generation, we were able to make that move. Think of all the virologists and the cell biologists and immunologists and epidemiologists and the social behavioral folks and all the different scientists and clinicians who came together to make that success happen, to make a mortality rate that was doing this start to do this, and radically reverse the death rate from that awful disease. So we have to be kind and smart at the same time because we're taking care of real people. These are free-range humans. They're complicated folk with clinical complexity and social complexity, and you have to use all of your heart and all of your brain to be good at helping folks. So be smart about stuff that matters. Be important, but not self-important. Do good, make a difference, change the world, that's all. If you could do that by Thursday, that'd be good. When we did the Georgia Health Disparities Report, we reported that every week 100 U.S. babies die who would not have died if there was no black-white infant mortality gap, that a baby dies every day in Georgia that would not have died if there was no black-white mortality gap. And you read those statistics and it just makes you want to cry, and you say, oh my gosh, it's the poverty and the social determinants, and what are you going to do? And we realized it was making folks powerless to think that way. So we changed our messaging to say, we have an opportunity here. We could save a baby's life every day in Georgia if we could eliminate the black-white infant mortality gap. That'd be worth doing. But we have to align ourselves with people of faith and optimism. People like Archbishop Desmond Tutu, who reminds us that the structure of the universe is one that there's no question at all that goodness and laughter and justice and, yes, health equity will prevail. Did you know? Do you believe? Since 1990, child mortality worldwide has declined by almost 50%. All those child deaths related to poverty and malnutrition and pneumonias and all these other things all over the world, down by 50%. And we are on track to reduce those by 50% in the next 15 years. By 2030, we will reduce child mortality worldwide by another 50%. But only if your generation gets in the game and stays on it and believes that we can make that accomplished. Madison, Wisconsin, Dane County, Wisconsin, gives us an example of a path to health equity. They had the same black infant mortality problems that Georgia has. Black infant mortality rates up here, white infant mortality rate up here, 2-to-1 ratio forever and ever, amen. Been going on that way just since anybody could remember. And all of a sudden, over a period of 10 years, the black infant mortality rate dropped to the white rate. In 10 years, they achieved equality. In 10 years, they achieved equality of premature birth rates between black and white populations. You think, well, how on earth did they do that? First of all, notice that they did do it. It is possible. Disparities are not inevitable. New York Times interviewed folks. They asked the public health director. Public health director said, well, you know, we do some stuff. We do some prenatal outreach, but you should really go talk to those midwives over at the community health center. They do evidence-based care, but it's very relational care, and they connect with people. And they went and talked to the midwives, and the midwives said, well, yeah, we do what we do, but it's those social workers that really create the enabling services and have emotional connections with our patients. And they went and talked to the social workers. Social workers said, well, we need our legal advocacy team because they help people with housing issues and domestic issues and all this other stuff. And they went and talked to the lawyers, and who would have thunk it? The lawyers said, oh, well, we work with the churches. And the churches said... And they asked a woman who delivered a baby in Madison, Wisconsin, and she said this. She said, with all of that, I came to believe that my baby would come into the world loved and supported. And that made all the difference. It was all of the above, all hands on deck, all of us working together to make it possible. But disparities are not inevitable, and health equity is achievable. So, be kind, serve others with compassion, be smart, but be smart with a purpose. Study, learn, research, tackle important questions, meaningful questions, and be important. Not self-important, but making a difference in the world. Morehouse School of Medicine has given me a wonderful place for the past almost 25 years to be my own little unique self and to do what I could do to teach and to serve and to try and make a difference with a whole team and a whole family of folks who are committed to that same mission. You're here for that same mission. The admissions committee did not make a mistake. You are dedicated enough and smart enough. You can do this. And your own uniqueness is essential to us having the diverse team that we need to achieve health equity. So welcome to the family. Be your own happy, unique self. But be your best self. Thank you.